Is your child hard to understand when speaking? Does your child's attention drift when listening? Does your child struggle with phonics, reading, or spelling? Is he or she exhausted at the end of the day, or fail to monitor their voice volume or content? Any of these challenges could be related to auditory processing. Today, we have Doctor of Audiology Cydney Fox here with us to help you understand the role of auditory processing in learning and how to test for and improve auditory processing issues. This is LD Expert Live. Welcome to LD Expert Live, your place for answers and solutions for learning differences, dyslexia, and auditory processing and attention challenges. I'm Jill Stowell, founder of Stowell Learning Centers and author of At Wit's End, A Parent's Guide to Ending the Struggle, Tears, and Turmoil of Learning Disabilities. To get a free copy, go to parentsatwitsend.com. I'm so excited about this show today. Dr. Fox told me that she was mesmerized by auditory processing in her doctoral work. And I have to admit, it's a pretty hot topic for me as well. So we should have a lot of fun here. At Stowell Learning Centers, we really started digging into auditory training in 2000, and the impact it has had on our students and their futures has been incredible. Let's say hello to Lauren, who has been on much of this journey of discovery with me. She'll be our moderator for today. Good morning, Lauren.
Good morning. Hello, everyone. Let us know that you're here if you're watching live and where you're checking in from. We love to see all the different places all over the world where people are viewing live. So be sure to check it in the comments and let us know that you're here and where you're from. Parents, we have another resource for you, our private Facebook group, Mom Squad. So you can find that on our Facebook page or by searching Facebook groups, SLC Mom Squad. Like I said, it's a private Facebook group, a community of parents with kids and teens with learning and attention challenges. We share resources. I've been creating units or guides and posting a lot of different resources related to topics related to learning and attention challenges. We have a unit on dyslexia and we have one on auditory processing where I've posted a lot of resources for you. So be sure to join. We would love to have you as part of that community. And I'm really excited also because this Thursday is our PEACE meeting. PEACE is our parent support group. It stands for Parent Enrichment and Continued Education. We meet virtually, usually the third Thursday of every month. So our next meeting is this Thursday, February 18th at 5 p.m. Pacific time. And PEACE is a little bit different format than this show. We meet via Zoom. And so I really like it because I get to see your faces and that's really exciting. And I want you to be part of the conversation. It's really a meeting designed to support you and get your questions answered in real time. So in order to participate live, you do need to register at stowellcenter.com/peace. And again, that's this Thursday. Really looking forward to meeting all of you and seeing your faces virtually. So we have already a lot of people checking in. Let's see who's here. Let's see, we have someone, Digital Factor One from 𝗍𝗍𝗍𝗆, which is here in Orange County, California. We have Deborah checking in from Jamestown, North Carolina. We have Mary here from Oklahoma. Welcome. Leslie from Greensboro, North Carolina. Hey. Noelle Noelle, be sure to pronounce that right, from Washington. Wendy from Colorado, welcome. We have Anne from Minnesota. Hello, welcome. Let's see, make sure I don't skip anyone. Let's see. Ooh. Wendy from Florida. Hello, welcome. We have, looks like Doe from Massachusetts and Florida. Ooh, how are you covering both states? Great. Maybe you're in Florida for the winter. Smart. We have Veronica from Orange County, California. Great. Welcome. We have Kelly from Iowa. Let's see. Anne, hello to Dr. Fox. I highly recommend her. My daughter is a former client from Anne. Welcome. Cool. Elizabeth, oh, no, excuse me, Danita from High Point, North Carolina. I skipped one. Elizabeth from Connecticut. Welcome. Wow. Jennifer from Iowa. Hello. We have Glenda. Oh, from Orange County, California. I know your son was recently assessed in our Irvine Center. Welcome. Beth from Los Altos, California. We have, oops, make sure, hang on. We have Wayne from Utah again. Okay. Susan from Kansas City. Welcome. Jennifer from Bakersfield, California. Hello. We have, let's see, Allison from Corona, California, our neck of the woods here. Jennifer from Ohio, winter storm here. Oh no. Ooh, sorry, stay warm. Katie from Cape Coral, Florida. Welcome. Joy from Greensboro, North Carolina. And Janet from Greensboro, North Carolina as well. Wow, look at, we covered the country. Amazing. So excited. Oh, we got more people. Therese saying hi. Laura from New Jersey. We got to get that East Coast representing there. Okay, welcome everyone. This is, as you can see, a hot topic. And so really excited to hear what Dr. Fox has to share today. Start posting your questions and we'll check back in a little bit.
Great. Thank you, Lauren, and welcome everyone. If you're just joining us, this is LD Expert Live. I'm your host, Jill Stowell. Our guest today is Dr. Cydney Fox. Dr. Fox is an audiologist who has been in the field for over 40 years. After 23 years at UCLA, 3 years at USC, and 10 years in private practice, she decided to focus on auditory processing disorders, which is a learning problem affecting the auditory pathways. Dr. Fox lives with her husband in Granada Hills, California, and is the mother of 2 amazing sons and 2 wonderful daughters-in-law. Welcome, Dr. Fox.
Hi there. Hello, everybody from Los Angeles.
And all over, right?
Right.
Well, it is so great to have you here. I'm so excited about this. You have done so much work in the field of audiology. Why the focus on auditory processing? What is auditory processing?
Well, the focus happened because I believe that if you're really, really good at what you do, you eventually reach a burnout point. And I was at that burnout point. I was doing diagnostics. I was working with children. I was fitting hearing aids. And I just finally reached a point where I didn't have any more to give. And I was doing my doctoral work at that time. And we had a class on auditory processing. And all of a sudden, the little heart started fluttering and the brain started shooting off. And I said, wow, this is like putting together a puzzle. And I got very excited about it. And with focusing on that and deciding to focus on that and give up the other things, I was rejuvenated. It was wonderful. And I loved being an audiologist again. And so that's pretty much what the situation is. I forgot what your other question was.
Well, just kind of what is auditory processing?
Okay, well, auditory processing is, you got to think in terms of a house, and you're building a house, okay? And the auditory senses, the auditory ability is the floor of your house, okay? And it has to be intact for you to build your walls and your roof, put in your plumbing and your electricity. And if it's, and so that is your reading ability, your speaking ability, your language ability. And if your floor, auditory, has got holes in it, everything else will fall on top of it. So you have to go in through the brain, through the auditory system first and foremost, in order to achieve the language skills that we want our children and ourselves to have.
Absolutely. And really understanding auditory processing really requires some understanding of the brain. So let's talk about the brain. And you have an amazing analogy starting with an orange. So share with us about the brain.
Okay, let's talk about the brain. Let's talk about the cortex. And I want everybody to imagine an orange. And the orange is a stand-in for our head. Okay? Now, we're going to peel off the skin of the orange. So we're peeling off our skulls. And we're looking at what's underneath that. And you see that the orange has got some undulations in it, and it's got little pieces of skin running through it. And what you're looking at is the cortex of the brain. Well, what is the cortex of the brain? The cortex is the CEO, board of directors of your body, and it makes all of the decisions regarding how you are going to interact with your environment. Now, those pieces of skin that you see on the orange are stand-ins for the neuron tracks, okay? And so you can send messages from one area of the cortex to another area of the cortex via these neuron tracks, all right? And so it used to be that we thought you had this problem or that problem. And we've learned in the last 10 years, not even 10 years, it's not an either or situation with the brain. It's an and situation of the brain. Okay. So you can have ADHD, which is a cortical problem, and you can have auditory processing, and you can have dyslexia, and you can have ADHD, autism. All of these things connect because of these neuron tracks, and they can affect every different area of the brain. So now let's look at how the brain in this cortex is getting information. And we're going to cut the orange in half. And you've got such beautiful fruit there. And those are the subcortical areas. And that's where the collectors are. Okay. And that collects all the information. So the information goes into this area, and then goes up to the cortex. So we have a bottom up type of a process, okay? An input process, if you will. Now we've got a problem because we've got a right half and we've got a left half. And the brain has to be able to talk to itself. So we have to build a bridge, and the bridge is called the corpus callosum. And it goes all the way down the level of the brain. And signals from the right side cross this bridge and go over to the left side, and vice versa. Everything that we do has to cross this bridge in order to be able to get over to the opposite hemisphere of the brain. Now, when you got potholes on that bridge, then things don't get over in an affectatious manner. It'll start to go and then falls in the hole and then comes up and over. And so the timing is all off. And it will cause what we call an integration problem in auditory processing. The auditory processing is in the back of this bridge with visual processing. But stuff like motor processing, the right hand and the left hand doing things simultaneously, is towards the front of that bridge. Okay, that's the bridge. That's the orange analogy.
So now let's think about how language works. So let's take a word like cat.
Mhm.
What actually has to happen for us to receive and understand that word?
Okay, so you say the word cat to me, and cat travels to my ear through acoustic energy, and it goes into your ear canal and hits that eardrum, which vibrates, and is changed from acoustic energy into mechanical energy. Now you have to understand at this point, it's not cat. It's being divided down into its subdivisions, into frequencies and intensities and durations. And it goes into the middle portion of the ear with all those little bones, where it's changed into mechanical energy, and then goes into that snail thing, which is the inner ear, where it's changed into electrical energy. The electrical energy then jumps onto the nerve, the auditory nerve, and goes into the brain. And it's met by a traffic cop. And the traffic cop says, "Oh, this is auditory information. How exciting. You're going to get," for those of us here in California, "on the 405 and take it north." And so this information, the frequencies, the intensities, the durations get up on the 405, and every time there's an off ramp, it gets off, and it goes to the bottom of the ramp where all these little worker bees come and they start tuning and making changes in this signal. Now, it's kind of like, you can kind of describe it like a pit stop, okay, in a car race. The pit stop, if somebody forgets to fill up the car with gas, it gets up on the racetrack and runs out of gas and is out of the race. Right. That's not what happens with the auditory signal. If something didn't get done or didn't get done properly, it gets back up onto the freeway and continues its travels until it finally gets to the auditory cortex, okay, the top part of the brain, all right, where it may arrive correctly or it may arrive incorrectly. And at the auditory cortex, it's the first place that this stuff is decoded, all right? So it looks at the signal and says, "Oh, we've got a k sound, we got an a sound, and we got a t sound." Okay, it's not a word, it's just k, at. Well, if something didn't get done properly, maybe it says, "Oh, we've got a k sound, an ah sound, and a t sound," which, you know, when you put it together is a totally different word. Well, this k, at, then goes next door to the secondary associate cortex, where it's merged into cat. But it's not a word yet. It's not a word. It's cat. And then that gets sent over to the linguistic cortex. And the linguistic cortex takes out its huge dictionary to find out, is this a word or is it nonsense? And while it's doing that, the visual cortex starts screaming, "I've got a picture, I've got a picture, I'm sending it over." And so this picture and the information, the definition of cat and cat, all get put together into a folder, which is then put into a file cabinet in memory. And so whenever you hear the word cat or see a cat or read about a cat, it all gets pulled out of this file cabinet for your use. And that's also the reason why when you read the word cat or somebody says the word cat, you immediately see a picture of a cat in your mind, because they're all together in that same folder. So we've got the information in the folder in memory. Then the linguistic area goes over to get that information. Now, if that information was incorrectly put in there, all right, because it didn't get processed properly, then it goes there and it pulls out incorrect information, which then affects the top down, okay, the expressive ability of the brain to be able to, the output, to read, to be able to understand what it is people are saying, what it is you're reading. And so that all gets messed up because the input was wrong, so the output's going to be wrong. Mm-hmm. Now, suppose the input got in there correctly, and when the linguistic cortex and the linguistic processing system goes to pull it out, it misinterprets that information. All right, like the general getting information from the spies and sending out the wrong orders to the troops because the general misunderstood what it was that the information was. Okay, that becomes an output disorder. It at that point becomes a linguistic type of a problem, and it's from the linguistic cortex. Mm-hmm. So you can have an auditory component to that, but my job is to make sure that what is auditory is getting there properly. And then I turn it over to the speech language pathologist to be able to determine if the information got in there properly, then why is this information being incorrectly interpreted? And that's what I do as an auditory processing specialist, as an audiologist.
It's just amazingly complex how we get that information and how language works. Amazing. So
and the fact that the brain, when you think of a baby, of a fetus, and all these millions and billions of connecting going on, you wonder, how does anybody get born normally? Because there's so much that can go wrong.
It's amazing. You mentioned that auditory processing then is a bottom-up process, because it's everything that has to happen to get a clear, accurate message or input to the cortex. And then once that information is in the cortex, it starts getting interpreted, and that becomes then kind of a top-down process. So we have the auditory receptive language piece, and then we have the linguistic expressive language piece.
And on top of that, we also have executive function, memory. We have all of these other brain processes that are acting on their own information, which then acts on this information. And so you can have a multitude of things that are causing problems with everything else.
And that's one of the things that we're just so aware of when parents call us and they're concerned about their child's reading or their child's executive function or their speaking. You know, we really have to, there are so many different underlying pieces that could be at the root of the issue. And so, you know, we really have to assess to look at exactly what is causing the problem so that we can do the right intervention.
Yeah.
This is LD Expert Live. I'm Jill Stowell, founder of Stowell Learning Centers, and we're talking with Dr. Cydney Fox about auditory processing. Let's take a moment to check in with Lauren and our viewers.
Hello. Well, we have a lot of people checking in today. I want to make sure I get to everyone. We have Denise from Houston, Texas, and Katrina from Virginia. Welcome. And Patricia from New York. And Kim checking in saying hello, welcome. And we do have a number of questions, so I want to make sure I can get to all those as well. We have Laura here, and she has three questions actually. Her first question, we hear a lot from parents: how to deal with a child study team, or sometimes we refer to them as SSTs at school, student study team, that doesn't think her daughter has difficulties because she's able to get good grades. Advice there?
Oh boy, and I hear that a lot. You know, and what we find is that initially, and it depends what grade her child is in. Initially, what we see is that the kids who do well in first grade and do well in second grade start breaking down in third grade. So you have this child who's been doing very, very well, and then all of a sudden, instead of being in the top reading class, they're in the middle or the bottom reading class. And a lot of that has to do with the vocabulary. The vocabulary at about grade 3 becomes an auditory-based vocabulary. It's not a visual memorization type of thing anymore. Here in California, I don't know how it works everywhere else, it doesn't matter what they think. If you go to the office with a written request for an auditory processing evaluation because you feel your child is having certain types of problems, they've got, I think, 60 days to respond to you and to do it. You know, they just don't have an option here in California. I don't know if that's true in the other states, but the things that you're looking for, can the child and it's not academic stuff, all right? Can the child follow 2, 3, 4-step directions, okay, auditorily? Does the child say what a lot? Does the child sort of daydream? They're with it and then they're out of it, and then they're with it and then they're out of it, because they can't maintain their focus on what's going on auditorily. I know I'm forgetting 100 different things that I could tell you about, but you're looking for behavioral symptoms with the child. Does the child say huh a lot during the day, or what a lot during the day with conversations? So you're looking for behavioral types of things with your child that is not necessarily going into the educational process. The educational process in academics is higher, okay? This is output, all right? We're looking for the input to get up there. So it's those type of things. And I also say, if the parents feel there is some sort of a problem, there is some sort of a problem. You know your kids better than anybody else. And if your gut is there's something wrong with this child, sometimes you have to be the one out of your own pocket to take them to the specialists to have them evaluated and determine what's going on, in spite of the fact that they're getting good grades.
Yeah, I think we really have to educate, the team about what's going on, because that child might be getting good grades because they're going home and parent is working with them so hard. Or, as Dr. Fox said, they're able to memorize everything, and they get to a point, usually around 3rd grade, where they can't do that anymore, and it starts to take a toll. You may have a child that just works so hard to listen and be good and do everything, and then they get home and they are absolutely exhausted, or they fall to pieces, and the teacher never sees that. But of course the parent does. And so, I think it's really important. I totally agree. Parents know their kids. I've always said moms know. They know. And so, don't back down because someone says, oh, they're getting good grades. There's nothing going on. There is, if you see it, and you have to describe it to them behaviorally.
Yeah. I just evaluated a young lady who started last semester at the University of London in England. And she came to me because of the problems she was having auditorily and how hard she had to work and everything. And lo and behold, she had an auditory processing disorder. Not only did she have an auditory processing disorder, but we got her evaluated for vision, and she has a visual processing disorder. She started on some of the therapy that I recommended, and she said she already sees a big difference in her ability to be able to understand what's going on and follow and focus. So I think that's a really big win. So here's someone who went through high school and got great grades and matriculated into college, and in spite of that had these problems that nobody ever looked at.
Right. And it's really that input piece, because and then they have to work so hard because they're not getting clear and complete and accurate information to work with. And so they're working so hard to fit all the pieces together that they can, It's exhausting.
Absolutely.
It takes longer, but
and
lots of determination.
Right. I want to make sure Laura does have a 3-part question. Her next one is just asking about, and this is another hot question right now, is how, when a child has auditory processing difficulties, some advice for how to get all the information during virtual learning. So she says that teachers are running live stream, but daughter's at home. How can we make sure she can hear and process the information?
Turn on the closed captions. All the systems have closed captions on them. And so your daughter will be able to read what's going on while the teacher is talking. That has helped so many of my kids and kids who are having multiple types of problems, because they can do that. The other thing that really helps is that the kids can increase the volume. so they can make the teacher louder or softer or clearer. And this really helps a lot. So you have to play with your controls to be able to get that kind of a message for your child, where your child can understand what's going on. That doesn't mean that they understand necessarily the input of what everything that the teacher's saying, but that the teacher is understandable because they're loud enough and they're clear. And if they're not clear, that at least you've got the closed captions to be able to read what they're saying. And that seems to have helped a lot of kids during this very difficult time.
Great advice. Thank you. Actually, Laura has 4. This is another one, but she was hot on it. She was right. And she's like, I'm going to get my questions in early. Advice for, again, she's saying her daughter wears hearing aids for APD, but the child study team is questioning it if she actually needs them. And she's like, she feels like that's none of their business. How would you suggest that she go about telling them that? She's gone higher up the chain, sent articles to them. She knows hearing aids are controversial in the APD world and a newer treatment, but how would you recommend that she best educate the team?
If you'll excuse me from shooting from the hip, I would tell them it's none of their business. And this is what I've chosen to do for my daughter. And if they don't like it, tough luck, you know? I expect this to be carried through. And if they don't want to understand why, that's their problem. That's not my problem. Now, that's from a shoot from the hip. That's not a professional response. Everything that we're doing with APD is so new. We've got our national organizations fighting over it. Is there really something called APD? Is this an auditory problem, or is this a language problem? And the American Speech and Hearing Association has embraced that there is no APD. It's really just linguistic and language problems. And then when that isn't working, then we backtrack and get into, the auditory processing and the auditory area. Some of my colleagues have started putting on mild hearing aids. Now, what that is doing, it's allowing the child to get clear speech. If the brain hears clear speech, then it is able to process that. Someone, and I'm blanking on her, Nina Kraus, Kraus, at Brain Volts, which is the organization that she has in the laboratory at Northwestern University. And you can go to brainvolts.com, I believe. And if that didn't work, go brainvolts.org. And Nina has been very focused on the idea of auditory processing and has been able, with her studies, to show how the brain hears. And that whatever's going on here, so whatever I'm saying right now is going into the brain and is being replicated by the brain to be able to go through all these areas. It's just fascinating. And on the Brain Volts display, you can go into some of her talks, and she shows the brain doing this because they have worked at a way of being able to replicate and show what the brain is hearing in live time, in real time. And it's fascinating. This is new. This is the last 10 years. The thing is, and I do a lot of recommending of FM systems in the school, because if the brain can hear clearly, then it can replicate clearly. And so then it makes it easier to understand. And from Nina's studies using the FM systems, we call them RM now because it's remote mic, but the FM system was what they used for kids with hearing losses. And it's basically the same type of thing. And they did a beautiful study with a school who had kids that were dyslexic. And they did a lot of studying of these kids. And then prior to the school year, this particular school had 2 classrooms, 2 first grade, 2 second grade, 2 third grade. And And if that's a little wrong and there were more than 2, excuse me, but that's basically the idea. And they took one class and they put them all into these remote mic systems. And at the end of the school year, they repeated the testing of the brain waves, and all of the brain waves had come into normal limits, because when the brain hears clearly, it reproduces clearly. It's like, I explain APD as, you've got a sliding glass door that's fallen out of the track. Now, you can close that door, but it takes a lot of energy to do it because it's not in the track. What we're trying to do is to flip it back in the track. And once you get it back in the track, it doesn't go out again. And so that's what these RM systems are doing. That's what the hearing aids are trying to do, is to try to put the kids into the track again, and their auditory systems into the track. And one of the things that I suggest is that with the kids that are wearing, hearing aids, and I have recommended this for some of my kids as well, to retest them, repeat the test at the end of one full year and see how they're doing. Do you see improvement? And that's a big thing, because we're doing physical therapy on the brain, and you can't start off doing 100 push-ups, you start off doing 1 or 2, and then you build up to 3 and 4 and so on and so forth. And that's what we're doing with auditory processing. What we're doing is we're doing physical therapy for the brain to get the brain stronger. And really, with what we know about the brain now, any kind of brain therapy is not going to just focus on that one little area. It's going to focus on the whole brain, and the whole brain is going to get stronger because of it. I hope that answered the question.
Here. Yes, definitely. We already have Tara saying that her son uses closed captions. So just, kind of speaking to that recommendation. Thank you. And we do have quite a few questions. So, and then Laura's question quickly, how to best practice and work with auditory memory. She's asking for suggestions related to auditory memory.
Okay. Now you're out of my purview and you're into the speech language pathologist and the educational therapist and the psychologist area. There are a number of different types of programs that are available for being able to do that. And if you don't have your kid hooked in with a speech language pathologist at this time, I would do so, because they've got a lot of programs for doing this kind of therapy.
And we work a lot with auditory memory.
Yeah,
we do. And one of the things that that needs to happen is the student needs to be able to hear it again in their mind. So you may even, if it's a big challenge for them, you may have them, just kind of you give them an instruction or a couple of directions of things they have to do, and have them just repeat it out loud first, but then work towards whispering it, then work towards just hearing it in their mind, is just a way to start to work on it. There are a number of different ways to work on auditory memory, but you've got to get that inner language working. They've got to be able to hear it in their mind.
Yeah, and don't forget, the brain is working in sync with itself. So you have an auditory processing problem, and there may be an auditory memory component to that, or there may just be a memory component, period, that has nothing to do with auditory. It's everything that's coming into the brain. So that's why you can't just look at one little area. You have to look at the whole thing, the gestalt of the brain, because there are different people that need to work on different areas.
Right, absolutely. And if the message that's getting to the cortex is compromised, kind of like a bad cell phone connection, well, then that creates confusion, and they may not be able to remember because there was confusion around whatever that was.
Someone has described auditory processing signal as Exactly that. You've
Mhm.
got a bad cell connection and you're hearing every third word and you're trying to put together something. And, and I think that's a very accurate way of being a description of what auditory processing can be. That doesn't mean everybody with auditory processing has that particular weakness, but I think it's a good description because that way you understand, oh, wow, I know that when I can't understand on my cell phone, I have to call the person back or the person has to call me back because I can't follow the conversation. So
Mhm.
imagine these kids in school trying to follow the teacher when they're hearing every third to fourth word of what the teacher is trying to say. And by the time they figured out what the teacher is saying, the teacher's already 4 or 5 sentences down the road. And so they've missed all of that information. They haven't had the ability to be able to fill in what's missing. And that's
Mhm.
another thing, auditory closure, being able to fill in what's missing and the ability to be able to do that.
Absolutely. And this kind of question piggybacks off of this from Jennifer. Can you tell us more about how auditory processing issues can look like inattention? Exactly what you just described, that a lot of symptoms of inattention can have an auditory root.
Well, it looks like inattention because the child is exerting so much energy.
Mhm.
You know, when you're out there and you're doing something and it's just exhausting you, you just kind of close your eyes and you lean back and you take a breather and then you get started again. And this looks like inattention, or that they can't focus auditorily on what's going on. And so they do daydream. These are some of the things. I have a particular questionnaire that I use called the Fisher's Auditory Questionnaire. And it asks things like, does your child have inattention problems? Can they pay attention for 1 to 2 minutes, from 3 to 5 minutes before they lose it? Does your child daydream a lot?
Mhm.
Those types of things could be an indication of an auditory processing problem because they auditorily can't keep up with what's going on without exhausting themselves.
Right.
Mm-hmm. Absolutely. We have Karen checking in. I missed you in all of the thread. Karen is a faithful viewer. Hello, welcome from Sacramento. We have Wayne asking, how do tubes in kids' ears affect their hearing and speech?
Wonderfully. The reason that you have to get tubes. Okay, now remember that eardrum, okay? That's moving like this. Well, behind the eardrum, where those bones are, is an air-filled cavity, okay? And it's supposed to be filled with air. And there's a tube that goes down into the back of the throat, okay, which is called the eustachian tube. Now, your eustachian tube is opening and closing hundreds of times during the day, okay? And what happens is when you get allergies or you start getting something, the tube doesn't open and it doesn't close properly. It's more that it doesn't open. And so you've got fluid in the ear, that area, to clean it and to keep it moist and to keep it free of debris and working properly. When this eustachian tube closes up and swells shut, this fluid that's in there normally has no way to be able to get out into the back of your throat. All right. And so it starts to build up and build up and build up and build up. And so the eardrum, which is doing this because of the fact that there's air behind it, excuse me, starts doing this and not being able to move as well. It's the fluid that causes the hearing loss. And then the longer the fluid stays there, it starts to become viscous. It starts to thicken. And then that again increases the amount of hearing loss. So when you get tubes in, and someone actually, and I don't remember who it was, it might have been Dr. Jdrger, put a microphone into an ear that was filled with fluid to see what it sounded like. And it sounds like we're underwater, and this is what it sounds like. So imagine a kid trying to learn language, and they've got these big gaps in language. As soon as you get the stuff out, okay, the kid can hear again. Everything is restored because there's nothing wrong with the nerve of hearing. It's the transmission where the problem is. So, and I had children with tubes, and my husband has tubes, and he's an old guy, and he's had tubes, you know, most of his adult life. And because he's got cruddy eustachian tubes and he keeps filling up with fluid. And it's wonderful when you free the fluid from the system, and then the system can operate the way it's supposed to. And we find, interestingly, a large number of kids who had chronic middle ear effusions in their formative years have APD. That doesn't mean it's a cause of APD, but it's interesting because a lot of kids who had this also then develop APD.
Mm-hmm. We have so many questions. I want to get to a couple more right now, and then because there's a lot more to share, and then we'll get to the rest of them kind of on the next go around. We have Wendy here. This is great. I had my son's ears checked by Johns Hopkins. His hearing is normal, but he has delays. He's also nonverbal, severe autism spectrum, sensory processing disorder, and ADHD. My question is, how is sensory processing and what you are explaining, how do they affect each other? My son moves constantly, which I know can help with speech. Thank you. So and I believe we're going to talk about that, just how, you know, we have an integrated system, we have an integrated brain, we have different levels. We talk about the learning skills continuum and how kind of all those skills can affect auditory and speech issues.
This is an excellent question, and one I can't totally answer because, again, this is outside of my scope of practice. When you've got autism, you remember the first thing where we had all the skin coming off onto the top of the orange? Autism, it's like a weed, and it stretches out, and all of its roots get into everything else. And the severity of the autism will affect other cortical areas. I think the people that do most of the therapy work with the autistic kids is a good resource for that. We know that kids with autism most likely have an auditory processing problem. Is it because of the autism that's causing that, or is there the auditory processing problem being made worse because of the autism? So I can't really, you know, it's like the same thing. I mean, you talk. Everything you do, you talk to him, you tell him what you're doing, all of this sort of stuff, and you know, and work with your specialists to be able to figure out what you can do to help maximize his ability to learn speech and language.
And so much of that's happening with the sensory processing. You know, it's kind of like what we were talking about with auditory, where if you're not getting good input, it's kind of like that bad cell phone connection. And so your world can be a little bit confusing. And so if you think about sensory processing, if you're not getting accurate information, you know, from touch, you don't have a good sense of pressure or where you are in space or how much force you're using, or you're not getting good input through your visual system. So you can't accurately judge depth or where things are in space. I mean, it causes your world to be confusing and different than the world that most of us experience. And so those children are, you know, first of all, we don't understand what their world looks and feels like. But also they're not getting clear, accurate information to support developing language and other pieces of learning that we might expect. So really working with those systems, with movement, with auditory training, with you know, your sensory diet to get them to process sensory information better, to work with the visual system. All of those things are contributing to improving the input and integrating it with the other systems so that they can now begin to think with that information and learn and grow with it.
Yeah. Absolutely. And I know, Jill, you're going to talk about the learning skills continuum a little bit. And that is usually what we see with kids with sensory processing or autism, is that there are issues going on and what we call the core learning skills level, with reflexes and with the motor system. And we have found it to be most effective when you start there first. And really working with a lot of those underlying skills. So we do have, I'm gonna have to cut it off just because I really, Jill, want to give you a chance to talk about that. I will try to get through as many questions and hellos as possible, just because there are so many people watching live and participating. This is definitely a hot topic that relates to a lot of our viewers. So, but I want to make sure that we get to all the information you have to share today. So I'll check back in one more time and try to get through as many questions as possible. So keep posting. Thanks.
All right. Thank you, Lauren. And thank you everyone for contributing and joining us here. This is a huge piece of learning. And it is surprising how, I want to say, understood it really is. So it's really great to have this opportunity to really discuss it with all of you and with Dr. Fox. At Stowell Learning Centers, we look at learning like a continuum that builds kind of like a ladder. So academic and social skills are up there on the top 2 tiers of the ladder. And this is where students are working at school. So when Dr. Fox talks about top down, it's kind of the top of that continuum, you know, is the top part. We were the high level skills, the academics and social skills. But there are whole sets of underlying skills that need to be in place in order to support the academic learning. And so when you look lower down on the continuum, you see the core learning skills level that Lauren was mentioning, where, you know, that's movement and visual skills and those developmental skills that kind of help us become organized human beings. And then we have processing skills and executive function. And if any of those supporting skills are weak or inefficient, it can cause the student to struggle. So if we want to permanently change a learning challenge, we have to identify and develop those weak underlying skills. And that's where you get some of that bottom-up approach. Auditory processing fits in that processing skills level, that blue level there. And there are many different skills involved with auditory processing. And we've touched on a few of them, but Dr. Fox, can you talk about what you're looking for when you do auditory testing and what some of those various skills are that you're looking at?
What I'm looking for, what all of us are looking for, is where in the auditory pathways the breakdown is occurring. And based on where so we're looking at anatomy and physiology stuff, okay? Where the problem is coming from also tells us where and what kind of therapy we need in order to build that type of problem and strengthen it. I'm looking for integration problems, left side, right side. Does the left ear hear as well as the right ear in terms of, now remember, the left side of your brain for the vast majority, probably 95% of everybody, even your left-handers, is where your language center is. And so you get information coming in the right side, but it has to go over to the left side to get to this type of situation. So you've got the left side and the right ear together, and the right side and the left ear together. And we see what's called an amblyopia, or a left ear weakness, okay, because the sounds aren't and the information isn't coming across the way that it should. And this can affect timing information for speech, can affect how you hear speech, people who are very, very monotone and don't have a lot of inflection in their voice, it's probably coming from the right hemisphere. And so we have to find out where the problem's coming from, because I had a psychiatrist who said one of the things that I use when I see this kind of dichotic listening, two-ear listening problems, and she would use the therapy that I use when I have that problem, and she said, I'm just not getting good results with it. I don't understand what all the hullabaloo is. And I said, well, that's because you're not using it correctly. You're using it as a one, this cures all, and it's not. You've got your phoneme problems, which is coming from the auditory cortex. Can they tell the difference between a b and a p? And what do we do to our children in first and second and third grade? What are their spelling tests? They're all rhyming words. And so you don't know what to do because you worked on these words in the kitchen the night before and your child got 100% of them correct, but they flunked the spelling test or got 50% of it wrong once they got into the room, And it's because the kid could not understand, did the teacher say fun or son or one, particularly if they don't use it in a sentence, And so that's coming from that particular area. Some of the other areas, and I'm trying to think really quickly about this, is the right hemisphere areas, the temporal issues. There's a difference between saying, oh, and for those of you in the Midwest, oh, look at the snowdrift by the window, and oh, look at the snowdrift by the window. The same words, but they mean two totally different things because of where the inflection is and the accents. The same thing with words, where you've got and I've forgotten all of the words that I could give you as an indication.
I like to use the word Disneyland because we have Disneyland here in Southern California. So I want to go to Disneyland, but if I accent it in the wrong place, I'm going to go to Disneyland. Well, what is that?
Wherever in the world that is, yeah. I was going to say, it's the words that we use that are spelled exactly the same but have different meanings, okay? And that's because of where the accent occurs, okay? And this is all right side, okay? So you've got to do different things to build up the right hemisphere so that it transmits the sounds across that bridge to be able to then strengthen itself. There are a lot of other things, and my colleagues who are seeing this are going to just come down on my head because, well, you forgot this and you forgot this and you forgot this. But this is just kind of an indication. And I do want to put in a plug, if I may, at this point. There is an organization called IGAPS, IGAPS, and it stands for International Guild of Auditory Processing Specialists. And you can go online to our website. These are the practitioners. These are not necessarily the researchers. These are the practitioners that work with the evaluation, the therapy, all of this sort of stuff. And you can get a list of people in your general area, okay? Or you can go on and you can ask, I live in Steamboat Springs, Colorado. Is there somebody in my general area that I can go to have my child evaluated? It's a fabulous group of people. We have some international people on it as well. And it's a very interactive site for us professionals because we're always in a chat room talking about something and getting help from somebody else with a case maybe that we're not sure where it's supposed to go at this point or what we should be doing with it. So I just want to encourage everybody to go to igaps.org and take a look and reach out to some of these wonderfully trained, wonderful people who are on the site. Thank you. That was my plug.
Yeah, absolutely. It is, not every audiologist has a specialty in auditory processing. And so this is a great resource, igaps.org, to find people who do have that specialty. So when someone comes to you, when someone goes to an audiologist, typically they're going for a hearing exam. How is that different than an auditory processing evaluation?
Okay, the hearing test is looking at your peripheral hearing. That's your outer ear, your middle ear, where the fluid accumulates, and your inner ear, which is where that snail thing is, okay? It doesn't go beyond the nerve of hearing, all right? So when you're doing that, you're listening to beeps. Do you hear it? Do you not hear it? You know, can you repeat words? Can you not repeat words? Can you repeat words in noise environments or not? That's what a hearing test, a diagnostic hearing test is, and that's what the majority of audiologists do. The audiologists who are involved in auditory processing are looking at the central, the central area, the brain area. And we're looking at what the brain does with what it hears, okay? And that's the difference. The traditional test is, what do you hear? And my test is, what do you do with it? And that's the big difference.
So, and so an auditory processing disorder is really when that signal, the ear is hearing it properly, but before it gets to the cortex of the brain, it's being compromised in some way. One of those little freeway off ramps, you know, and then sending the information incorrectly to the cortex.
That's correct. That's exactly it.
And as we kind of have talked about, auditory processing problems can be really hard to spot if you don't know what you're looking for. And so children and adults with these challenges are often really misunderstood. And I know that you have been to many, many IEP meetings and you educate the team, which is really important. What do you really want teachers and other IEP team members to understand about these students?
You have a problem here, and it took me 4 or 5 years before I finally figured it out. They talk education, and I talk anatomy, physiology, and we don't understand what each other is saying. And the IEP team is going, but how is it going to affect their academics? And I have to be able to understand that and put that into something that they will understand, that is their language,
their world,
and
right?
so I start off every IEP that I do, we start off with the orange, and then we go into cat. So everyone goes, oh, well, now I understand what you're talking about. And particularly when there's integration problems, and we're talking about the bridge, and I say, okay, now remember this bridge, because we're going to be coming, this is integration. I'm going to be talking about this a lot with John, okay? Because this is where the weakness is coming from. So I try to make it at their level and use words that they're going to use, and not just present a report that's full of gobbledygook that nobody understands. When we go through the tests that I've done, I say to them, I'm not going to read this. It's gobbledygook. You're not going to understand it. I'm going to demonstrate what we did. And then I demonstrate, you know, what happens and what we're trying to do. And then they and you can see the little light bulbs going off, you know, oh, now I understand what you're talking about, you know. And I forgot what the question was.
just what we want IEP team members to understand about our kids with auditory processing challenges.
And that we're talking about the brain, and the brain enables the academics to occur. Right. And they can't say, well, that's all brain stuff. You know, we want the academics. You can't jump from the bottom of a ladder to the top of a ladder without climbing all of the different rungs that are on it. And they're looking at the top of the ladder and what happens with the top of the ladder. And it's really sad, because sometimes in the IEP meeting, in order to get them to approve things I want, I have to say, this should improve academic. You should see an immediate improvement in academics, in academics. They should be able to do the core program much better and at a higher level. And you have to, wind it back around with that.
Right.
And so I think you have to keep in mind all the time, they don't understand what you're talking about. And you have to understand what they're talking about and couch what you're saying into their terms. And I think that's what I think you can scream here to high heaven, and you're not going to get a change from the academics in terms of really understanding this. You're going to have to do it from us being able to give them information so that it might be new for this first kid, but for the second kid, they may say, oh, we talked about something like that with blah, blah. And yeah, I kind of understand what's going on now. They're never going to totally understand everything. And I'm not going to understand everything that they're talking about. But you have to get on the same communication platform. Otherwise, it's worthless for everybody involved. And you'll never get what it is you need to get for those kids to be successful in school.
Right, right. And I think, always approaching from an educational standpoint, educating each other. And with auditory processing, I find with people, the cell phone example is probably the best. Although I loved what you did when you covered this, you covered up your mouth like that. That made it really evident. Wow, no wonder the child isn't getting the instructions or keeps asking me things that I just said. They're not getting a clear message. So even though they look like they're with me, they're not. So I think those are helpful demonstrations too. This is LD Expert Live. I'm Jill Stowell, founder of Stowell Learning Centers, and my wonderful, wonderful guest today is audiologist Dr. Cydney Fox, talking about auditory processing. Let's get back to those questions, Lauren.
Yeah, I'm sorry. It's just the chat is just lighting up and we want to get to as many questions as possible. We're going to have to do a speed round. We're going to have to do rapid fire as quick as possible, just because there are so many happening. We have Danita saying, I know children have common mix-ups and difficulties because they are beginning to speak and read. How early can you tell when a child has signs of an auditory processing disorder and begin testing? So at what age?
Okay. That's a tough one. All of the tests, most of the tests that we use today were normed on 7-year-olds and up. All right. So you will very often hear someone say, I can't test the child until they're 7. There are a great number of new tests that have come out that will go down to 4.6. So you can do it that early if you have the correct materials.
Okay. We have Veronica saying, we had an audiology exam last year. It was determined that the child had no dominant side of the brain. What would be the first remedy for this?
How old is this child? This is a real, how do you determine there's no, does that mean the child is ambidextrous? Does that mean that they're using, it doesn't mean that there are 2 language centers? Does it mean, I don't understand what they mean by that there's no dominant side of the brain. And again, the brain for auditory doesn't develop to adult levels where the 2 sides come into being until they're like 11 or 12 years old. So again, depending on where you're going, just remember, like if you're on Jeopardy and they say, which is your stronger ear, it's your right ear and your left brain. And that's what's the strongest and should be the dominant side for most of the things. For other things, you're going to have the right side being dominant. So I'm sorry, I don't understand specifically the question because I don't understand the information.
Okay. Probably, I mean, she says it's an audiology exam by dichotic listening test where it's exactly average or exactly in the middle.
Well, good. That means that the left ear and the right ear are functioning the way they're supposed to. The child has achieved adult norms.
Okay. Kim is saying, I have 2 children with APD. My oldest has severe autism and her auditory processing is severe. My youngest is a typically developing child with mild APD and vision issues. What general accommodations could be made in the classroom for both? My oldest is nonverbal. I will say that I did post in Mom Squad a suggestions for accommodations for the classroom is in our files. So if you're in Mom Squad, you can access that, what we generally give to parents to ask of schools. Any others?
You know, the only other thing is that, you know, again, you go with your autism specialists for your oldest, for your youngest. You know, you have to, depending on how old your child is and what the specific needs are for the child. And you have to go to your specific specialist for that to be able to find out and have the child evaluated.
We talked about eye gaps. Where does one look for an evaluation for APD? So you said eye gaps, which I believe we posted a link in the chat and also the banner below. Kim is asking, do you use ABA to treat APD?
I'm sorry, what?
Applied behavior analysis, which is often—
I am not familiar with that, so I can't answer that question.
Yeah, usually ABA targets behavior and not the true skill of auditory processing.
Right, right.
Yeah. Patricia, my daughter's IEP is speech and language delayed. Dr. Donna Geffner diagnosed her with APD in 2nd grade. It was a game changer.
Donna's great.
Glenda is asking, what causes APD? Is it genetic?
Who knows? It is, you know, it is. We don't know. We do see some, when a father has it or a mother has it, that the child has it. So there has to be some sort of a genetic link. We know that a lot of kids who have fluid end up developing it. Dr. Bellis, she developed APD because she was in a car accident and she had a brain injury. You know, we are always asking about concussions and things like that when we do our initial evaluations. So what causes it? We don't know. I mean, we know what it is, but we don't know how it gets that way.
Yeah. Kim is asking, my older daughter with autism hears music better than spoken word. Is that common?
Well, music is processed differently than the spoken word. Every area of the brain is involved in the process of music. And so it's not left hemisphere oriented. It's left hemisphere, right hemisphere. It's the frontal lobe. It's the, you know, so it's all of the lobes of the brain. And so, yes, I would anticipate that she would do better with music. And that's, again, another thing that we recommend frequently is get the kids involved in, because of the music studies that have been done by Dr. Krause, get a child playing a musical instrument for a minimum of 2 years. And that's with lessons, and it strengthens the entire brain.
Going along with the genetic kind of question, Elizabeth is saying, my oldest son has been monitored for APD since he was 4. He has an extensive history of ear infections, but my 5-year-old never had an ear infection, and the school staff recently told me they're curious if he has an auditory processing disorder because they're noticing similar deficits in him. And so you were saying you do see that, a familial component.
You can see that, and I'd say get your 5-year-old evaluated by somebody.
Great. And Christine is asking a similar question. What kind of accommodations should be on an IEP? Again, we have a resource in Mom Squad, but we talked about, you know, it needs to be tailored to the child.
And it, yes, exactly. And it depends what areas of weakness the child has as to what the accommodation should be.
Exactly. Says, outside baby, in these COVID times, where's the best place to start for older students about mid-elementary that may exhibit signs of auditory processing challenges?
You write the letter to the school. You say, I'm concerned that my child has auditory processing difficulties, and I want to get an evaluation. Now, depending on the school district, they may or may not be able to do that. And if they can't, then go on the IGAPS list and find somebody near your home and pay out of pocket and get them evaluated.
Okay. Anne is wondering, what are some examples of methods used to improve auditory processing issues with kids?
Well, if they have, for example, a dichotic problem, there are a number of different types of programs. You've got acoustic pine
Oh,
with the right hemisphere. You've got 𝗃𝗏𝗃, which does left hemisphere, right hemisphere. You've got Dr. Music is putting out the DIID in a form. You can do it. A lot of these things you can that are research based, we can make it into an auditory base. Dr. Katz has oh dear Jack, forgive me, Syracuse phonemic words and sentences methods. So you have a lot of different types of things that are out there, and people use different types of things. And because I'm not doing the therapy, the only programs that I just mentioned the programs that I specifically am recommending use for, but that is not by any means the only thing that's out there.
We do a tremendous amount of work with auditory training at our centers, and we do a combination of passive listening and active auditory training. And the passive listening is really a frequency-based auditory training that helps the brain to process a full range of sound frequencies so that you're going to get better discrimination, clearer message. And we use programs from Integrated Listening Systems, ILS, and Advanced Brain Technologies, both of which have a lot of research and information on their websites. And then in addition to that, we do in our sessions, whether remote or in-house, we do a lot of work with active auditory training, getting those frequencies then into the voice using, specific kinds of auditory lessons and a microphone and headphones. There is a piece of equipment called ForeBrain, which really helps to work with auditory training. It's a bone conduction microphone that your child can use while they're reading, while they're doing different kinds of lessons, and it works on integration as well.
ILS is wonderful.
Yes. We have Patricia kind of weighing in about, her daughter's a great student, great grades. She works extremely hard, but she struggles with test taking, and she already has a lot of accommodations. So she's asking for additional suggestions.
She just has to get more time to take the tests, or a different environment in which to take the tests.
Right.
And those are accommodations. What Jill was talking about with our auditory training programs, there could be a comprehension component to this child's struggles. And that's what we'll target. We'll do the auditory input training with the audio vocal training, and then also the comprehension piece, visualizing how to analyze a test question, things like that. So we do a large amount of that as well. Let's see, we were posting a lot of the links for Mom Squad. We posted the link for Brain Volts. Let me make sure there's so much here. Let's see, people agreeing. Let's see. Karen is asking, if your child was tested and diagnosed at age 9, is it worth to get tested again to see where they are now at 17?
Well, the question that I've got, did they get therapy for it, or did they get diagnosed for it and nobody provided anything else for them? If they didn't get anything, then yeah, you should test them again, and let's get some sort of, therapy going on them before they leave high school. And if they did have the therapy, then yeah, we need to see what kind of a change occurred.
Yes, absolutely. We have some fans. Lori is saying, "Love Dr. Fox."
That's my cousin. Okay,
yeah.
So that's
hey, but we love her too.
Nice we do too. You're definitely a fan favorite here. Let's see. And just piggybacking off the question about getting retested, Patricia's asking, will insurance cover testing for auditory processing?
That's a very interesting question. Maybe it depends on your plan. Do they cover the full amount? This is a very time-intensive procedure, okay? I spend anywhere from 6 to 8 hours on it per child. I'm not going to accept reimbursement of $63 from the insurance company. So a lot of us do not accept insurance for this. And we give you a super bill, and then you can argue it out with your insurance people.
I hear you. Wendy is asking about equipment, pros and cons of the asymmetrical filter versus, I believe this is 𝗔𝗂𝗱𝗃 or FM systems. So some technology.
Well, since I don't know anything about the asymmetrical filters, and I'm not sure where that's coming from, is that from Dr. Porges with his stuff with the ILS? I can't respond to that. The FM system is merely a microphone that the teacher has wearing like an lapel mic. The kid's wearing like 2 receivers that look like small hearing aids. And so it sounds to the child like they're sitting in the teacher's lap, okay? They get very, very clear speech. I don't know what a filter type of system would do, but the idea is to give the child clear speech. So I would, question all of that, but I need to find out what they are.
Mm-hmm. I think, so the 𝗔𝗂𝗱𝗃 is a low gain hearing aids that specifically.
Okay. Yeah, that, a lot of people are doing that now. And then we go back and we say to the parents, what are you seeing? And we say to the kids, what are you feeling? And a lot of them say, I've noticed that Johnny does a whole lot better when he's wearing the hearing aids. And sometimes you just need things to be made a little bit louder so it can be clearer.
Mm-hmm. Absolutely. Veronica, she was asking about the brain dominance. So the child is 9, between cap dots, hear builders, integrated listening system, or fast forward. What would you recommend best for an integration problem?
I love cap dots. I just finished a study that's going to be published in Hearing Journal sometime in the next couple of months with 2 of my colleagues. The problem with a lot of these is that they don't have any kind of peer review research. But this is going to, and cap dots is one of them. I love cap dots, and I've seen tremendous improvement using cap dots. Fast forward is looking at decoding stuff. You wouldn't use fast forward for a dichotic listening problem. Hear builders is an all over listening type of thing, and it does a little of this and a little of that. And I don't remember what the other one was.
Let's see.
ILS, I think.
ILS.
Again, ILS is fantastic. It's a great integration system, but it's doing something different. It's not looking at dichotic listening problems. It's looking at something else. So it depends on what you're specifically looking at as to which therapy is going to address that better. So you just don't say, you don't put APD in a basket and say, okay, give me a therapy that's going to work. You have to figure out which one's going to work for what specifically APD is for you.
Right. Exactly. Yeah. Therapy has to match the root. Absolutely. Or exactly what's going on. Deborah Anafarian, a past guest, 2 weeks ago, she was on our show. She said, thank you for all this information and more clarity on APD. Much appreciated. And we have Karen checking in for brain training, along with other programs through Stowell, help my son improve auditory processing skills. Elizabeth is saying this session is fabulous, but I want more. I learned so much today. I'm loving that I'm seeing more and more education on APD. Keep it up, ladies. Thank you so much for this. We probably will need to have a part 2. Just because
one thing that people can,
go ahead.
Pick up this book, When the Brain Can't Hear. It's by Terry Bellis. And it talks about what specifically is going on. And I highly recommend it. And that might help a little bit if you want more.
Very good.
Perfect. And we'll post a link to that in the chat. If I didn't get to your question. I thought I went through everybody. It's hard. I mean, we're both on YouTube and Facebook, and comments coming in through both. So I tried to get to everyone. But if I didn't get to your question and you have a follow-up, you can always PM me or post in Mom Squad. Again, Mom Squad is our private Facebook group, and you can find it on our Facebook page, or searching Facebook groups SLC Mom Squad to join. We also posted the link in the comment section as well, so you can request to join there. And don't forget that our peace meeting is this Thursday. We will be discussing the continuum, all of the skills, kind of all those underlying skills that Jill touched upon that could be contributing to a child's struggle in school or in life. That is this Thursday, February 18th at 5 p.m. Pacific time. And you do need to get the Zoom link by registering at stowellcenter.com/peace. Thank you, everyone. Thank you, Dr. Fox. I know that was
welcome.
a lot.
Thanks for having me.
Yes, such a relevant topic. And thank you so much to everyone who participated in the chat today.
Absolutely. Thank you, Lauren, and all of our viewers. I do want to say to you, since we're saying, you know, this is such a topic that so many people are so interested in, on, I believe it's April 6th, we'll post it up in the chat. We do have 𝗶𝗶𝗹𝗹 on our show, and he is truly one of the pioneers in working to improve auditory processing. And so you don't want to miss that show with him. And check out his book as well, called When Listening Comes Alive, because it talks about auditory processing, and there are exercises, pretty simple exercises that you can do in the back of the book to start to improve work on auditory processing. So we have that coming up. Auditory processing challenges can have such a sneaky and devastating impact on learning and social communication. And here's what I want to leave parents with today: knowing that auditory processing can change, which opens the door to improving speech, reading, communication, comprehension, and any other areas that have been affected by that auditory deficit. Well, Dr. Fox, it has been amazing having you today. We could talk about this all day, and I'm just delighted to have had you on the broadcast. Thank you so much for
Thank
the
you so
wealth
much for having me.
Yeah, well, thank you. You just shared a wealth of expertise with us, and we really appreciate it. Here is Dr. Fox's information. Check out her website for more information about auditory processing and testing. Dr. Fox practices in the Los Angeles area. But remember, if you're not local to California, you can check out igaps.org to locate auditory processing specialists in your area. This is LD Expert Live, your place for answers and solutions for learning disabilities, dyslexia, and attention challenges. We're live on YouTube and Facebook every Tuesday at 10 a.m. Pacific. Next Tuesday, we have another one of those really, really hot topics. We're talking about all kinds of issues around executive function skills with a real guru in the field, executive function coach, Seth Perler. Get your questions ready and be sure to join us next Tuesday at 10. Stowell Learning Centers are open for remote sessions and screenings. We're also seeing students on site with all of the COVID precautions. We work with children and adults doing targeted brain training to improve auditory processing, dyslexia, attention, thinking, and learning. If you would like a free consultation for yourself or your child, give us a call or visit our website at stowellcenter.com. Thank you again, Dr. Fox. You're amazing. And thank you to all of you, our viewers who are watching, sharing, subscribing. Have a great week.